Aneurysm. Aneurysms are outpouching or dilation of the arterial wall, and common problem occurs in aorta. So here there will be outpouching or dilation of the arterial wall occurs. There are two main classification for aneurysm: the true aneurysm and false aneurysm. True aneurysm again divided in saccular and fusiform aneurysm. A true aneurysm is one in which the wall of the artery forms the aneurysm with at least one vessel layer still intact. So in true aneurysm, at least one vessel wall layer still intact. So the walls, the different layers of vessel is tunica adventitia, tunica media, tunica intima. Tunica intima is the innermost layer, media is the middle layer, adventitia is the outer layer. So in this, one of the layer will be still intact in true aneurysm. And the true aneurysm further divided saccular aneurysm and fusiform aneurysm. In fusiform aneurysm, it is circumferential and relatively uniform in shape. So fusiform aneurysm, that is, usually it is circumferential and relatively uniform in shape. But in case of saccular aneurysm is a pouch-like aneurysm. There will be a narrow neck connecting with bulge to one side of the arterial wall. So in the saccular aneurysm, there will be outpouching of the one side of the arterial wall. That is known as the saccular aneurysm. But in case of fusiform aneurysm, all the area will be circumferentially, the person will have aneurysm. That is known as the fusiform. Next one, false aneurysm. False aneurysm, otherwise known as pseudoaneurysm. And this false aneurysm, actually it is not an aneurysm but a disruption of all layers of arterial wall resulting in bleeding that is contained by surrounding structures. And false aneurysm result from trauma, infection, graft to artery anastomosis, surgery. Okay. So false aneurysm or pseudoaneurysm means it's not an aneurysm but disruption of all layers of the arterial wall resulting in bleeding and that contained by surrounding structures. And it is usually occurs in infection, trauma and anastomosis or the graft surgeries. Next one, dissection aneurysm. Dissection aneurysm means usually aortic dissection aneurysm is the common aneurysm, and here the aneurysm is most commonly occurs in thoracic aorta. It is mainly result of tear in the intimal layer, that is the innermost layer tear, that cause aortic dissection or the dissection aneurysm. And this aneurysm is common in men than women. And here, due to the tear, there will be collection of the blood in that area, and gradually it will ruptures, and the condition will be life threatening. Mortality rate is 90%. So that is the dissection aneurysm. So these all are the types of aneurysm. It is divided in two forms: true aneurysm, Saccular aneurysm, fusiform aneurysm. Saccular means sac-like or the pouch-like aneurysm only in the one side of the vessel wall. But in fusiform aneurysm, all area will be uniformly involved in the aneurysm. It is the fusiform and it is in circumferential nature. Dissection aneurysm, it is mainly occurs in thoracic aorta and that is mainly due to the tear in the layer of arterial wall. False aneurysm means it is not aneurysm, and here due to rupture or infection or surgery or the graft anastomosis, there will be disruption of the all layers of vessel wall that leads to bleeding and lastly ruptures. So that is the false aneurysm. Thank you.